The following program is sponsored by Excalibur Insurance Management Services.
In this week's show, we will take a break from politics and take a detour into an area that we have dealt with a lot for all 7 years of this show. That being the drug epidemic we all face in this country. Specifically, we'll break down the landmark new drug law in the state of Oregon, passed into law by statewide referendum. This law, known as the Drug Addiction and Recovery Act, decriminalizes cocaine, heroin, methamphetamine, oxycodone, and other Class 1 narcotics. To help break down this landmark law and its impact in Oregon and beyond are two experts in the prosecution of these top-tier and dangerous drugs. Our first guest is attorney Joe Peters, who rose from street cop to serving United States Presidents Bill Clinton and George W. Bush as a leader in the effort to combat drug trafficking and battle international terrorism. Joe oversaw the country's 26 high-intensity drug traffic area programs and their budget of $250 million. He also represented the White House with police, prosecutors, governors, mayors, as well as non-governmental organizations. As a former federal prosecutor, Joe's accomplishments included the convictions of Philadelphia mob boss Little Nicky Scarfo, along with 16 of his associates, in a 3-month-long trial with an anonymous and sequestered jury. As a result of these convictions, he received the United States Department of Justice's John Marshall Award. The Associated Press called Joe and his fellow federal prosecutors, quote, the modern-day untouchables. Joe also served more than 15 years as an Assistant Attorney General of Pennsylvania. He was first named the head of the OAG's Drug and Organized Crime Division. Joe's expertise on these issues has been recognized by Fox News, CNN, and television networks as far away as London and Italy, which have asked for his expert on-air commentary. Joe was a graduate of King's College and received his Juris Doctorate from Dickinson School of Law. Joe was the son of former Scranton Mayor Eugene Peters. Our second guest is first-term Lackawanna County District Attorney Mark Powell. Mark has made drug enforcement and the opioid crisis his top priority, creating a Fresh Start program to get lower-level offenders into treatment, while aggressively investigating every overdose death and prosecuting those responsible for supplying the fatal drugs. Mark also co-chairs the Lackawanna Recovery Coalition, a multidisciplinary community group that provides awareness, education, and prevention programs. Prior to being an elected district attorney, Mark spent 27 years as one of the area's top criminal and civil trial lawyers. He is a graduate of Villanova University and received his Juris Doctorate from the Catholic University School of Law and the rare degree of Master of Laws in Trial Advocacy from Temple Law School. He is board certified by trial specialists as well as the National Board of Trial Advocacy.
This is the Volpe Report, a weekly news and political interview show examining the latest local, state, and national issues with Chuck Volpe. Insightful, informative, controversial, the area's premier political talk show, the Volpe Report.
Welcome to the Volpe Report, my good friends, plural, Joe Peters, and our District Attorney, Mark Powell. Thank you for being here. In the state of Oregon, they had a referendum, which passed, which decriminalizes some of our most dangerous Class 1 narcotics. And before we get into questions, let me just be clear about the specifics. This was known as Measure 110. Also known as the Drug Addiction and Recovery Act. It goes into effect February 21st, 2021. What it does is for cocaine, heroin, methamphetamine, non-prescribed, oxycodone, and several other illegal drugs, Class 1 narcotics according to the federal government, they will be decriminalized in Oregon. So, I said when that happened, I mean, I've been on the planet for 60 years. I've been a lawyer for 35. Did criminal defense work a while ago now, I acknowledge that, but am familiar with the criminal justice system, as most attorneys are, and know them better than a district attorney and an attorney general, at prosecutors, no less, to have on this show to talk about it. So before we get into some of the specifics, first blush, when you hear that, Joe.
Outrageous. And at the worst time. You know, we don't talk about it now because, as you said, politics has eclipsed who we are, and then the COVID virus right behind it. But the heroin fentanyl crisis has not gone away. And then what happened was you had advocates, and I'll mention the lieutenant governor, nothing personal, but I'm on the other side of this, wanting to make marijuana legal recreationally in Pennsylvania. Now, who does that on the heels of another drug epidemic, which we haven't solved, heroin fentanyl? Right. And now you see states who can't even wait to legalize recreational marijuana, right, want to decriminalize the hardest drugs that we have. And then they want to use a system where the taxes from marijuana are going to pay the treatment for another drug. Now, is that counterintuitive or not?
It would seem so to me.
Yeah.
It would seem so.
So it's just outrageous. Is it a money grab? Is it part of a greater agenda? I don't know, but it could not happen at the worst time.
Mark, your opinion as our district attorney of Lackawanna County.
We're all looking for better solutions in order to reduce overdose deaths. And I think everybody would agree that treatment really is the option. The problem with a broad sweeping law like this is it really can promote drug activity. These are highly addictive drugs, Schedule I drugs. So I have to question the science behind that theory and what's it based on. We do know treatment works, but there are a lot of great programs in place, diversionary programs that require treatment, a part of the criminal justice system, and they work and they have a long history. In Lackawanna County alone, our drug treatment court has a 20-year successful history. So we need to work towards treatment to break the cycle, but this seems to be a drastic step in the wrong direction.
Well, you mentioned, Mark, I'm familiar with, of course, the drug treatment court in Lackawanna County. A visionary model proposed by our now President Judge. Well, I think Trish is about to become the President Judge Corbett, but our former President Judge of Lackawanna County, former district attorney, former candidate for Supreme Court of Pennsylvania, our very own Judge Michael Barace. It was his brainchild, along with some others. But it's been heralded nationally. He's been on national news, in national publications. It does work. It is kind of a diversionary program, and instead of putting people into jail. But as we talked off camera, you know, it has teeth. And by that I mean is that if you pretty much throw the middle finger to, the treatment part, then you go to jail. So there's a coercive effect. And that's one of the things that incarceration does, to be a deterrent and to coerce behavior. But in this case, it's ostensibly to save a person's life and get them off the hardest drugs. So, Joe, your thought on, you're familiar with the drug court in Lackawanna County.
The drug court, you know, for years, and I come at this as a former cop, as a former chief of police of the State Bureau of Narcotics Investigations, all the undercover operations.
Sure.
And then as the state's top drug prosecutor under many attorneys general, and then a federal mafia prosecutor, and then 2 White Houses in the drug czar's office. Right. When I got to the White House, and it was the last 2 years of the Clinton White House, and I stayed on in the first 2 years of the George W. Bush White House, there was this struggle with what do we do about the drug issue. And one of the silver bullets, and maybe it's an overstatement because there aren't many things that can solve a problem like addiction, but it was a concept called the drug court. Now I'm talking 2000.
20 years ago.
And I remember being accused as a prosecutor at that point of being a traitor because I was an advocate, and it was in my portfolio in the White House to deal with state and local governments and police and prosecutors. But it was a silver bullet in the sense that, one, there was the recognition that a drug user, not the violent, murderous drug gang member whom the criminal laws are there to deal with, but the user is a health issue. So why don't we around the table bring the prosecutor, the police, the treatment specialist, the psychologist, the judge, and give that person a choice. You either go to jail or you go to treatment. Right. And there was that coercion, and people said, you can't coerce people. Oh, yes, you can. And jail is a great lever to have. And it worked. This law, by decriminalizing the worst drugs, unhinges and usurps and upends the whole concept of a drug court. With this law, you can pay $100 like a traffic ticket, and you don't even have to go to treatment.
I can't believe you're right. I've read the law. I mean,
Yeah.
It's an amazing thing.
Yeah, and plus the whole notion. I remember the first drug czar I was a deputy to was a 4-star general named Barry McCaffrey, who was Bill Clinton's drug czar. And when all of these ballot initiatives were moving forward across the states for marijuana and medical marijuana, you know, he had this saying that he used to say, "God damn it, Peters." He said, "We don't vote for our heart medicine at the ballot box now, do we?" So you put on the ballot, no science here, no FDA, nothing, saying it's okay now, basically is what you're saying.
Right.
Decriminalization is a fancy word.
Right.
It's okay
Right.
to use the hardest drugs, and drugs like meth that almost instantly, in some cases, rewire your brain and make you an addict for life. And if you don't care about the human cost, now it's the taxpayer's responsibility when you're an addict, because you're not a good mom, and you're in the ER, and you're clogging up the system, and you're causing workplace accidents, and you're not working.
Okay.
So that's what this is going to do. And if it gets legs across the country, we're in real trouble.
And Mark, turning to you, I mean, some of the drugs he's talking about is he mentioned meth rewiring. It also, in certain cases, with crystal meth and the like, produces violence in some cases. Yeah. And what do we tell the people that are in the hospital in a coma while the person that perpetrated the crime, because apparently it's drug fueled, you know, now where drugs and alcohol have never been a defense, as you're well aware. You can't say, well, I didn't mean to punch him 27 times in the face because and put him in a coma because I was under the influence. Well, now we've complicated the criminal justice system because those things, the state of Oregon has said, are legal to have. So, you know, now if we have such things as insanity defenses, the state said it's legal to take these drugs, and they're going to bring in, I would think, and if I'm against you in a trial, I'm going to bring in doctors and experts to say it was this legal drug that produced this behavior. We've added now a component to criminal justice convictions and other charges to juries by judges. And what your thoughts as district attorney on some of that?
Yeah, I'm not sure it's going to create additional defenses, but it certainly creates a lot more confusion. And what we have are laws in conflict, existing laws currently, even with our medical marijuana, it's illegal on the federal level. So it doesn't give a lot of clear direction for people, which then tends to be an excuse people use that they thought they could do it. And then that kind of reduces the consequence or increases the sympathy that, you know, how do you know what to follow when there's so many conflicting laws? So we don't like to add confusion, and we certainly don't want to condone. And my fear with this Oregon law, saying it's decriminalized or it's okay, just a $100 fine, you're almost condoning the type of drug. And what does that do to our next generation? It almost gives them a pass or an encouragement to experiment. And these drugs, beyond other drugs, are highly addictive right at the inception. So once they try, they can get hooked, and they go down a path where there's not a lot of disincentive not to do it.
And you're taking away the one arrow in the quiver of that adolescent or that high school student to be able to say, I'll get in trouble.
Right.
I'll get kicked off the football team.
Out of school?
I'll be kicked out of school. Believe it or not, the science shows that kids want that excuse because it's the only thing they have to counter peer pressure.
Which is devastating, as we know. It's a problem for all of us. Once Oregon says it's okay, you know, not far away from Oregon is another pretty left-leaning, we'll say, liberal state, being California, among the most progressive of states, and others that have already have legalized recreational use. The other thing is the domino theory. You know, the first one falls. So, Mark, there's
a big money incentive from the states with recreational marijuana. alone. It in Colorado generated $250 million in 2017. So there is a great financial incentive to decriminalize these and have the state recoup some of the money. That doesn't make it right, but it does certainly cause the risk of the domino effect as other states see this as a money maker, a money generator. And the Oregon law itself is generated from their recreational marijuana, where they've diverted $100 million into passing this law and in theory providing some behavioral health treatment for it. So I think money is going to be the greatest motivator for other states doing that, but it doesn't necessarily mean it's right or right for society.
Well, believe it or not, we're already at our first break. We're here today, as you now know and have heard, with our district attorney from Lackawanna County, Mark Powell, and former federal prosecutor, as well as Attorney General of Pennsylvania, prosecutor, specifically of the Drug Enforcement of Pennsylvania, Joe Peters. So with Mark and Joe here breaking this down for us, we'll be back after these messages to cover some of the ancillary or collateral issues that this law has raised. We'll be back in a moment.
Catch Volpe's Views every Tuesday on the Fox 56 News First at 10.
Welcome back to the Volpe Report. Again, we're here today with Lackawanna County District Attorney Mark Powell and former state prosecutor and federal prosecutor and helping the drug czar in the West Wing of two presidents, Joe Peters. No one better we can have to talk about these things. Now, we've talked in broad strokes about the issues and the gut punch for me, which this issue is. Let's get into some of the specifics that underpin this law. According to Echo Northwest, they were one of the consulting firms that pushed this referendum and passed it in Oregon. They claim the cost of prosecuting misdemeanor drug cases can be as much as triple the cost of sending a person to treatment. Well, you're prosecuting misdemeanor drug cases right now out of your office, and you've done it, both felony and misdemeanors. Start with you.
Yeah,
Mark.
I find that quote hard to believe. Certainly there's a cost of incarcerating an individual, but when we're prosecuting someone with a use disorder, particularly with a possession charge, we're looking towards treatment. We're looking at court-directed treatment. And that can't be any more expensive than the type of treatment that they're referring to. It's supportive of some of the individuals in place with probation officers and advocates for individuals to get treatment. There is a lot of resources out there available for individuals with use disorders. So the idea is to provide the treatment versus pure incarceration because we know it works. But you can have both. It's not exclusive. You don't have to have one without the other. And the benefit of having the criminal justice system involved is accountability. And that's why these programs are successful. It's because of accountability. If I ask you to lose 5 pounds or go lose 5 pounds or go to prison, there'd be a lot more incentive to stay on track and exercise and eat healthy, knowing that there would be a price to pay. Here you're paying a price oftentimes with your life in an overdose.
Well, it would clear up the obesity problem to your hypothetical. Joe, your take on the same issue. They're claiming, this Echo Northwest, that it's triple the cost. This is, to me, a dubious statistic, along with others we'll talk about, but go for it.
First off, treatment, as Mark says, is always the answer when it comes to users.
Right.
And a law like this eviscerates the leverage of the drug court, which we've talked about.
Right.
Now, let me talk about costs, if I may.
Sure.
You've heard of big tobacco, right?
Yes.
You're hearing about big marijuana.
Yes.
This is about big drugs. And all of these initiatives, going back 20 years now, they started with, we need medical marijuana, and I'm going to get criticism for this, but I don't care. And they would put lovely older ladies saying, marijuana helped my elderly husband with a certain condition. And that's true. But the real agenda here was a Trojan horse to get in there with medical marijuana to legalize recreational marijuana. And guess what's happening across the country?
It's right there at our doorstep.
This is the next step. And you want to talk about costs? And you could look at various studies, but for every dollar saved or every dollar generated in taxes, even by marijuana, there's a cost of $10 to society. Better example, Colorado was one of the first to legalize marijuana, and it's over 5 years ago now. The Colorado Gazette, which is the Colorado Springs newspaper, was the biggest advocate of this marijuana legalization initiative, wrote editorials, stories, the whole thing. 5 years later, almost to the date, they do an editorial apologizing to their readers for advancing this whole legalization effort. And that's just marijuana.
Right.
And they showed the data. Impaired driving, deaths were off the chart. Students, this was supposed to be adults only and a disincentive to students because we were going to control it as a government.
Right.
Student use in Colorado was up higher than any other state. Emergency room admissions were up. The black market, the other argument to legalization or decriminalization is, we'll get rid of the black market. When I was a mafia prosecutor, the mob was into drugs just as much as anyone.
Of course.
And whatever the price is set or whatever the level standards are, a black market's going to develop underneath that.
Right.
So it does nothing. So just think about that, $10 in cost for every dollar generated in revenue.
Wow, that's a great answer. Now we're going to go to another of the sub-issues I've talked about. I keep going to the glasses like I always say in the show, like my guy Tony Kornheiser, I'm pardon the interruption. I love that. That's my sports fix every day. Now we have this issue. Mark Sutton, spokesperson for Drug Policy Alliance, a New York-based group responsible for crafting and campaigning for Measure 110 in Oregon. According to Mr. Sutton, Measure 110 will, quote, not waste resources imposing treatment on people struggling with addiction who aren't ready to seek help. Instead, expanding treatment options and access, making them available for those who are. Well, that segues right back into what we talked about on this nonsense about you can pay $100 and opt out of the treatment. So in other words, I can imagine your friendly neighborhood drug dealer standing on the corner and having his folks that get picked up for this drug. Of course, it's now been decriminalized, saying, look, I need the 100 so I can come right back and pick up drugs this afternoon. Well, you're absolutely right. You know, that's an investment in my business. Are you kidding me with this? Like, so in other words, they're going to wait for them to get ready. First, your opinion, Mark. You've had access and knowledge and dealt with addicts, obviously, in criminal justice as you have. How many people have you figure are going to do the right thing and decide they're ready, they bottomed out to go get help for this thing with no criminal penalty at all?
Yeah, it often takes that hitting rock bottom before people can bounce back or realize. And they're great success stories when they do, right, but they have to come to that realization. Getting involved in criminal activity, being prosecuted for a crime, knowing that there are consequences for their actions, oftentimes drives them to rehabilitation and promotes their success. And that's why the diversionary programs are so successful. You simply wait for people to come in your door. There'll be a lot of rehab centers going out of business because addicts don't see the break in the cycle. They're just too focused on their next fix.
Of course. And Joe?
Yeah, the data shows, I mean, longitudinal studies for years show that people will not ask for help. They're always reinventing themselves and convincing themselves, and you have to coerce them. And I used to deliver speeches to groups and say that, and people would say, that's awful. You can't coerce anybody. That's unconstitutional. That's immoral. No, they're never going to decide on their own. You're saving their lives by coercing them to get treatment.
There's no question about it. So amazing. And now we go to the third subject, and I've got to tell you that this component of the issue was a bit of a shock to me. The viewers of this show have heard me talk about and, of course, condemn the abhorrent behavior of certain police officers in this country. Obviously, Derek Chauvin, the Minneapolis police officer that started the greatest racial unrest in this country probably in over 50 years, since the late 60s, when he kneeled on George Floyd's neck until he was dead. Disgusting and awful. And there are issues, not for today's show, that we'll be dealing with going into the future, some of which we covered in the past. But you may say, well, what's the relevance of that to what we're talking about today? Well, I'll tell you what the relevance is. The criminal justice system, these groups claim they're promoted Measure 110, believe that, I quote now, the criminal justice system continually uses the drug laws as an excuse to police and incarcerate persons of color. This occurs in the United States at such disproportionate rates, they're often discussed as the modern equivalent of the old Southern Jim Crow laws. So, before I give you my opinion, I think you know what it already is, but we'll start with you, Mark. Your view of that police departments are using the drug laws to basically discriminate and incarcerate people of color, African Americans, Hispanics, Latinos, and the like.
I just don't see the correlation. So, I mean, do we need to do a better job and not racially profile and not discriminate? Absolutely. Our officers have to be educated and sensitive to those issues and be aware of the issues black and brown folks are facing. But that is a complete and separate issue and not related to drug enforcement. We all can do a better job. The reality is there are just a few bad cops who tarnish the reputation of many, and the vast majority of the officers out there are doing things the right way. But sure, that type of reform needs to be looked at, but it's separate and distinct from any of this. And to mix the two, it has to be intentional for a whole different purpose than promoting safety and reducing drug activity.
Yeah, and your take on it, Joe. You've heard what I just said.
The narrative there is so twisted.
Right.
And in fact, laws like this have a disproportionate negative impact on people of color, because laws like this impact the inner city greater. Right. It's just like shootings in America. There are more black on black shootings than any other racial combination. I remember being the chief of narcotics and going into neighborhoods, bad neighborhoods, where some cops wouldn't even go into them in Philadelphia. And remembering African-American mothers saying, please, we want the police. Don't listen to what's on the news. They would say that. We want the police. It's our only line. We want the kids pool test. I talked to this one woman, I'll never forget it. And I said, what are you talking about? She said, we want to be able to have our little blue kids pools out on our stoops in inner city Philadelphia and not worrying about our kids playing in the pool in the summer being shot by gang members.
Another out-of-body experience for me this past summer was when in the state of Washington, right by Oregon, and Seattle specifically, created a 16 square block thing known as the CHOP zone. I can remember coming home from work one day and turning on the news, and who do I see? I see two African-American families, meaning by that a mother and a father. And there were two groups. There was a mother and a father, and there was a mother and a father. Both were, or I should say all in that party, were crying, trying to explain to America that each one of them had a son, a young African-American boy, shot and murdered in the CHOP zone. While a narrative was coming out, see how great this is when we let people express themselves. And to your point earlier, they were telling stories about how ridiculous this is, and the inverse of defunding the police and wiping out law enforcement, that they were asking for it. They were asking for the police to come into Seattle to clean up the neighborhoods. And now I've read that basically there are going to be the lawsuits coming now, that their immunity, the mayor and the city's immunity, they cited various U.S. Supreme Court cases, citing the 14th Amendment and the 5th Amendment, which is the taking clause, that's what you allowed to happen. In fact, condoned it by number of statements and other things. It's good that people start hearing about it now. This is still part of our country. Again, we were here today with Lackawanna County District Attorney Mark Powell and former drug enforcement officer and federal and state prosecutor Joe Peters to talk about the Act 110 referendum that passed in Oregon decriminalizing all Class 1 narcotics. We'll be back again next Sunday at the same time.